If you test positive for COVID-19 in Ontario, you may soon have to stay home for fewer days. An announcement is expected this week from provincial health officials about whether they'll follow their U.S. counterparts in cutting the COVID isolation period. But doctors and stakeholders are warning against the move without first addressing issues accessing important resources.
It could make the pandemic worse by spreading more cases unless it's done very carefully and with the right measures in place.
The U.S. Centers for Disease Control has recommended reducing the isolation window for Americans who catch the coronavirus from 10 days to 5 days if asymptomatic, followed by 5 days of wearing a mask when around others. Making high-quality, well-fitting masks available to everyone is a key component, says this emergency room physician in Toronto.
You can still be contagious 7, 8, 10 days after your initial positive test. So if it's not done properly, like let's say your staff aren't wearing N95 masks like this, you're still going to expose other people. There's been a hesitancy to recognize how airborne the virus is.
The decision south of the border was driven by research about when people are most infectious, typically 2 days before and 3 days after you have symptoms. It comes as airline workers are sidelined by the Omicron surge.
There's no question, even before Omicron, there were significant staffing shortages in many sectors.
Business groups say they're in favor of adjusting the guidelines here if the science supports it, noting the change is motivated by a growing reality that the virus is here to stay.
We need to know how best to live with COVID. If you're going to live and proactively manage our existence with COVID, then our testing capability have to be enhanced.
In addition to staffing shortages, the province is also dealing with a testing shortage. Ontario's top doctor was supposed to provide an update Tuesday, but postponed to consider the new CDC guidance against Ontario-specific evidence.
I can't wait to see what Dr. Moore has to say about this.
But the NDP's health critic agrees the priority should be on making rapid and PCR tests readily available.
I can tell you that right now, getting a PCR test, it takes you a week to book it, and it takes you another 4 days to get the results.
The leader of Unifor tells CityNews encouraging infected workers to go back to their jobs is a gamble on their lives, noting public health policy should not attempt to resolve chronic labor shortages. Caryn Ceolin, CityNews.